Hi, everyone. It's Dr. Lindner. Let's take a look at the control of respiration. There are going to be cortical influences, which is like neurological control, and then there's chemoreceptors. So, cortical influences allow conscious control of respiration that may be needed to avoid inhaling noxious gases or water. So, you can, with using your brain, you could say, I'm going to hold my breath for as long as I can. That's conscious control over respiration. There's smoke and dust particles. I want to hold my breath for a little bit. Chemoreceptors, the this is these are found centrally and peripheral chemoreceptors, and they're going to monitor oxygen and carbon dioxide levels, and they're going to provide input to the respiratory centers. Now, the respiratory centers, the main one is within the medulla oblongata. That is the main control of respiration. And that's where you have cranial nerves 8, 9, 10, 11, and 12 that also their nuclei originate there. And the biggie is cranial nerve 10, which is vagal nerve. That is a biggie. The chemoreceptors, you'll see that we have these carotid bodies, aortic bodies. These are involved in kind of sensing what's happening within the blood, like what's the level of oxygen, what's the level of carbon dioxide, is there too much acidity in the blood or not? And then respiration is used to try and get rid of some of the CO2 and some of the hydrogens that are located there. So if we have hypercapnia, this is going to be an increase in carbon dioxide and thus also hydrogens, which creates a lot of acidity, and that's going to stimulate central receptors. There's hypoxia, which is a deficiency in oxygen level, and that's caused by low oxygen in the arterial blood. Could be due to high altitude, could be some sort of airway obstruction or fluid in the lung that can create that. That's where you use a pulse oximeter to simply look at what oxygen levels are.